Namaste. Rhinolith is asked as a short note question in the university. It is a calcified mass in the nasal cavity which is formed by deposition of mineral salts over a nidus. This is a nidus over which mineral salts of calcium, magnesium will deposit. The nidus can be a small exogenous foreign body, a blood clot, or inspissated secretions. Over this nidus, there will be slow deposition of calcium and magnesium salts. With time, this mass will grow and become large, irregular. It fills the nasal cavity due to which pressure necrosis can occur. This is the etiology. Let's understand the clinical features. It more commonly occurs in adults. The patient presents most commonly with a unilateral nasal obstruction and a foul-smelling discharge. This foul-smelling discharge is often blood-stained. Ulceration of the surrounding mucosa can occur. This ulceration will cause frank epistaxis and neuralgic pain. On examination, the color of the mass will be grey-brown or greyish-black. This mass will have irregular surface and a stony hard feel. Sometimes it will also be surrounded by granulation tissue or granulations. We have seen that rhinolith is a hard mass, so the differentials are going to be hard structures such as impacted foreign body in the nose, calcified polyp, osteomas. All of these have a stony hard feel, malignancy but rarely. The treatment is very easy. There is a rhinolith, so we have to remove it. It is removed under general anesthesia through the anterior nares. If it is small, then we remove it in this way. And if it is large, we first break it into pieces. And after breaking it into pieces, we remove it again through anterior nares. Now some hard and irregular ones which cannot be broken down into pieces, they have to be removed by lateral rhinotomy. I want to add a point in feel here that it can be stony hard, but it sometimes may be brittle. So brittle that a portion may break off while manipulating it. We have seen that rhinolith is basically a stone in your nasal cavity, and the stone is going to block your nasal cavity, due to which the patient is going to present with nasal obstruction. There will be some nasal discharge. On examination, you will describe the stone that it is grey-brown in color, hard feel, it can be brittle, it may break off while manipulating, and in treatment, what will you write? That we have to remove the stone under general anesthesia. Thank you. Please subscribe and watch my ENT series.